Hey, ladies and gentlemen, this is Carmine Sabia for Explain America, and the White House is getting pretty tired of the lies coming from the Democrats and the media about this shutdown. And Press Secretary Karoline Leavitt, she just lowered the boom on one reporter. Before we get started, please make sure you like, comment, share, and subscribe. Those little things really help us out, and they help our channel continue to grow. These reporters, they report what they want to report, and they've been really kind of moving the ball forward for the Democrats. It's like a referee in a football game spotting the ball an extra yard to help one team. That's what they're doing. And they're trying to pin this on Trump and the Republicans, even though the fact of the matter is, Republicans passed the bill to keep the government open. They did. It's the Democrats who refused to vote along with it and keep the government open. See, we can talk about the policy issues, the differences later, but let's keep the government open. That's not what they wanted to do. They wanted to hold you, the American people, hostage. And they are. They are. And they're doing it in part for health care for illegal immigrants. I don't give a damn what they say. They're lying. They use a wraparound lie for this. It's like a loophole. So they're technically telling the truth, but in reality, it's a lie. I've explained it on this channel before. But Karoline Leavitt, when this liberal reporter asked her about it and basically called it a lie, she dropped the hammer. And she explained it better than I did. So I really want you to listen to her, because when you're arguing with your liberal friends, this is going to help you. I want you to listen to her, listen to what she said, listen to this reporter kind of freak out and back down, and then let me know what you think in the comments.
Thank you. At the top of the briefing, you made a statement about that the Democrats are interested in giving health care to illegal immigrants.
Yes, they are.
U.S. law already prohibits that. It's a 1996 law saying that they cannot give unauthorized immigrants any federally subsidized health care coverage through Medicaid, the Affordable Care Act, or the Children's Health Insurance Program. There seems to be a disconnect in the messaging.
Are you denying that Medicaid money has never gone to illegal aliens in the United States of America?
I'm not denying anything. I'm asking you if you can explain the disconnect in the messaging.
I most certainly can. The Democrats' proposal, their continuing resolution, let me just reiterate, the Republicans' continuing resolution was a clean continuing resolution. There was no partisan politics injected into it. There were no conservative wish lists injected to it. What the Republicans want, and still want to this very second, is a clean continuing resolution to fund the United States government. What did the Democrats want in their continuing resolution? They inserted a provision to undo a provision in the Working Families Tax Cut, the One Big Beautiful Bill, that ended taxpayer-funded health care illegal benefits for illegal aliens. Democrats' proposal would require Medicaid to pay more for emergency care provided to illegal aliens than Medicaid does for American patients who are disabled, elderly, or children. And this bill would have also allowed California to continue a gimmick that funds its Medicaid for Illegals program. Those are things that we ended, the Trump administration ended, with the passage and the signage of the One Big Beautiful Bill. And it is an undisputed fact, a fact that under the Biden administration, illegal aliens were absolutely receiving taxpayer-funded health care benefits. In fact, in fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion. That's $9.1 billion taxpayer dollars that were going to emergency services for illegals. Between President Trump's last full fiscal year under his first administration and Joe Biden's last full fiscal year, Medicaid spending on emergency services for illegal immigrants nearly tripled. There was an increase of 196% between 2020 and 2024. And I have a chart here for you, and I'm more than happy to email it to you. I'd also like to add, because some were asking dishonest questions yesterday about emergency rooms. In Southern California, according to healthcare professionals in 2023, under the Biden administration, Southern California's, quote, entire healthcare system was being bombarded with illegal immigrants and forcing American patients to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health system in 2023, leaving an uncompensated bill totaling over $10 million. So when a legal alien goes to the emergency room, who's paying for it? The American taxpayer. The main safety net hospital in Denver had to turn away patients due to the massive influx of illegal immigrants into the community, and UC Health hospitals in 2024 reported their system was under stress from an increasing number of migrants. As a result, according to the head of emergency departments and urgent cares across the hospital system, quote, access is impeded for everyone. These are healthcare professionals who dealt with this directly, and there's a lot more where that came from. It is an undisputed fact that Democrats want to give taxpayer-funded healthcare benefits to illegal immigrants, period.
Karoline.